Welcome to Healthy Living on the Voice of America. I'm Lenore Moudou. Autism, you may have heard of it, or maybe you haven't. It is a disorder that is usually first diagnosed in early childhood. Children with autism might have problems talking with you, or they might not look at you in the eye when they talk. They may have to line up their pencils before they can pay attention, or they may say the same sentence again and again to calm themselves down. Some people with autism never learn how to talk. On this two-part special, we take a special look at autism, a condition that still remains a great challenge in the medical community, as well as for those who care for the patients. But first, Kim Lewis has a news brief for this week.
Egypt's health ministry says a teenage girl who tested positive for H5N1 avian flu has died, raising the number of deaths from the disease in Egypt to 14. According to the health ministry, the 15-year-old girl died at a Cairo hospital despite being treated with the antiviral drug Tamiflu and being placed on a respirator. None of her family members was found to have the deadly form of bird flu. The Egyptian government and the World Health Organization say 34 Egyptians, including several children, have contracted the H5N1 form of avian flu. 14 of them have died. Egypt has the largest number of human bird flu cases outside of Asia. Well, the government of the Republic of Cameroon decided recently that there will be free treatment with antiretroviral drugs for all people living with HIV/AIDS, eligible for this type of treatment. The program is expected to cost about $11 million this year, providing treatment for about 50,000 people. The drugs are being funded with grants from groups like the Global Fund and the Clinton Foundation. Cameroon is estimated to have an HIV/AIDS rate of more than 5%. The country of 18 million people is the most recent African nation to adopt a sweeping all-access program to antiretroviral drugs. Other countries include Senegal, Tanzania, and Zambia. Well, the sexually transmitted disease gonorrhea is now among the superbugs resistant to common antibiotics. Since the early 1990s, a class of drugs has provided a relatively easy cure. These antibiotics taken as tablets include the drug Cipro. But a growing number of gonorrhea cases is resistant to those drugs, and officials at the Centers for Disease Control, or CDC, for the first time are urging doctors to stop using them and switch to a different class of antibiotics. The CDC made the new recommendation after discovering that nearly 7% of gonorrhea cases among heterosexual men in a survey of 26 U.S. cities last year were drug-resistant gonorrhea. Well, gonorrhea can leave both men and women infertile and puts people at higher risk of getting the virus that causes AIDS. And that's the news brief for this week. Now back to you, Lenore.
Thanks, Kim, for the news. Well, on today's program, we will put a special emphasis on the condition autism. But first, April 25th was African Malaria Day, commemorated in combination with the U.S. Malaria Awareness Day, with the hope that political will and better prevention and treatment will overcome one of the continent's biggest killers. President Bush said the United States is dedicated to curtailing malaria in Africa and around the world. Voice of America's Deborah Block reports.
Malaria occurs in over 100 countries where more than 40% of the world's population is at risk. The World Health Organization estimates that at least 1 million people in developing countries die from the mosquito-borne disease each year, many in Africa. Young children are especially hard hit. In Africa, health officials estimate that a child dies from malaria every 30 seconds. And there are between 350 and 500 million new malaria infections each year. Poverty, poor health systems, and drug resistance are contributing to the problem. The United States launched an anti-malaria campaign in 2005, a 5-year program to cut malaria by half in 15 African countries. President Bush says the initiative can work.
Well, first it means distributing insecticide-treated bed nets. Secondly, expanding indoor insecticide spraying. Thirdly, providing anti-malaria medicine to pregnant women and delivering cutting-edge drugs to people living with the disease.
With malaria-resistant drugs, insecticide-treated bed nets are proving effective in controlling malaria. President Bush says the U.S. will distribute more than 500,000 bed nets in Uganda.
We're going to focus this distribution on children and pregnant mothers in areas of the country with the greatest vulnerability. And when we're finished with this effort, half of all the households in Uganda will own a bed net to protect against malaria.
A number of African countries have made inroads against the disease because of better prevention and treatment. Scientists around the world are working on vaccines to eradicate malaria, but there is currently no approved vaccine. Deborah Block, VOA News, Washington.
And thanks, Deborah, for this report. Well, we now turn to our focus of today, autism, a lifelong, extremely complex and offers devastating disability. Because people with autism can have very different features or symptoms, healthcare providers think of autism as a spectrum disorder. Scientists that are working to solve the mysteries of autism say their research points to genetic causes. The results come from the largest study ever done on the disorder, a study which looked at the genes of almost 1,200 families. Each had at least 2 autistic children. Voice of America's Carol Pearson has more.
Autism is a complex neurobiological disorder. It affects people throughout the world. It occurs in all racial, ethnic, and social groups and is 4 times more likely to strike boys than girls. Teresa and Chris Waddell have 2 boys with mild autism.
Autism is such a wide spectrum. Every child presents differently.
Which is why it is really a group of disorders called autism spectrum disorders, or ASD. ASD impairs a person's ability to communicate and relate to others. Those most severely affected cannot even talk. Scientists suspected a genetic cause, and this may have been confirmed by a new international study. Computers that can read billions of DNA signals in minutes showed specific genes and genetic abnormalities unique to these families. Geneticist Joseph Buxbaum is one of the principal investigators in the study. He explains what they found.
A smoking gun that implicates a series of genes that all work together that may together cause autism.
The researchers say the new study also shows environmental toxins do not cause autism spectrum disorders.
The evidence suggests that autism is over 90% caused by genes.
And not by just one gene, but by combinations of genes that may cause the different degrees and kinds of autism.
We have the beginnings of the beginning, I would call it. The message here is that there's great hope now.
The researchers say they hope their findings will lead to drugs that could reverse autism in 5 to 10 years. The researchers will now focus on the many genes they've identified in the autism families, hoping to find the exact role of each gene or abnormality and how they interact. Carol Pearson, VOA News.
Thanks, Carol. Joining me in the studio to discuss autism is Sandra Cunningham. She's the president of the Autism Society of America, District of Columbia chapter. Mrs. Cunningham, welcome to the program.
Thank you very much.
Well, it's so good to have you. Let me first ask you to kind of explain to us this condition very simply for people who have never even heard about it. How can we understand autism?
Autism affects an individual in areas of speech, language, social skills, and interaction. Each individual is different. Some talk. In fact, about 80% of persons with autism do talk. Some of the most severe persons with autism have problems in communications and may never talk as we know talking, but some do with speech and language communication, find ways to communicate their needs and their wants to their parents or their caregivers.
When I was reading about this condition, one thing that I found was the fact that more boys than girls were affected. Is it accurate?
That is correct. In our parent group in the DC chapter, presently all of the persons with autism, with the exception of one, is a girl. You know, it's one girl. When they go to camp during the summer, there are 8 boys and 1 girl.
Yeah,
so it's about
difference is there.
4 out of 5 persons are boys.
You've been heading the organization for over 5 years now. Tell us about what you do in your chapter.
Okay, the DC chapter was organized probably in late 70s. It was reorganized in 1978, and it's chartered by the National Autism Society of America. We have a group of about 15 to 20 dedicated parents. We meet monthly to discuss issues such as the best care providers in terms of dental and medical, psychological. We also bring guests in to talk about how to get benefits as their children become older. At age 18, they are eligible for supplemental security income. And once they leave the school system at age 21, 22, we also bring in guests to see how they can become a part of, in the district, the Medicaid waiver program, where they go into day habilitation programs or job rehabilitation. They also get transportation and various other therapies, and most of these are done at home.
And basically, if I understand it correctly, your organization serves as a resource for information, care, and support.
Right. Support and referral. That's our basic function. Until a very long time, the local chapters were not permitted to provide services. Our chapter incorporated another group for us to set up a camp program for our children. And it's only for children of members. And each week in August, they go away to a camp for 1 week. And members raise money for that purpose.
Is it a condition that is very frequent among children?
At this time, the CDC is saying it's 1 in 150 children. And that's down from the late 60s. It's expanding. Yeah. Every day it seems to be expanding more and more.
So what would be the reason that we go from less children to more children now, considering obviously medical treatment, medical care is improving with the time? How can we explain this?
I think more the diagnosis, there's been more emphasis on it, more publicity about it, so parents are looking at it. The medical profession has taken another look. When my son Troy was 18, 20 months old, the doctor said, oh, he's a healthy baby. He's a boy. Boys do things slower. There's nothing wrong with him. So it was not until someone asked me and said, can he hear, that I began to notice different things. And I took him to Gallaudet University, where they have an excellent program for hearing impaired, and they said, oh, he can hear. From there, I took him to Harvard University's Child Development Center, and they recommended that we take him to the Linwood Center, which is a special school for persons with autism in Ellicott City, Maryland, and he was given an official diagnosis of autism.
So obviously you became involved because your son has autism. He's, yes. You told me earlier when we spoke off camera that he's 35 going on 36.
Right.
What was it like 36 years ago to have a son with autism? One of the reasons you talked about was the fact that there was no diagnosis, very interesting or very good diagnosis back then. So what was it like 36 years ago to have a son with autism?
Well, it meant that we had to do I did a lot of phone calls. Troy had a lot of tests. It was like pulling hair because no one had any answers for the most part. And I saw one of the PSA blurbs about autism, and that's when I started asking questions. And
so a lot of people didn't really know what it was.
Right.
They didn't really know. So what kind of diagnosis did you receive from some doctors? Did they say, you just say one of his doctors said boys are slower than girls. What other diagnosis did you hear?
Most of them had none because of the age, between 3, because he was not quite 3. They didn't see anything wrong with him at all.
Mm-hmm. they didn't confuse it with other conditions like schizophrenia or anything like that?
No.
Okay. And you were able to follow through the autism link because you saw a PSA?
Yes.
So you were the one who went forward and told your doctor that he may have autism?
Yes, I did. And from there, he went to the Georgetown University Child Development Center, had more tests, more observations, a nutrition test. They did lead testing and came up with the same conclusion. Because there's no blood test you can give for a person to see if they have autism.
Indeed. Yeah.
It's based on observations, and most of those observations come from parents or caregivers, or if they're in school, from the teachers.
Okay.
But at this stage, teachers had not seen a great deal of this, yes.
All right, we're going to take a short break and we'll come and continue our discussion. So it's now time for a break. More healthy living when we return, so don't go away.
Hi, this is Janet Jackson, and you're watching The Voice of America.
What up? This is Ludacris, and this is Voice of America. And 5, 4, 3, 2.
Le plus difficile a été d'abord de convaincre tout le monde qu'on peut revenir au Rwanda et que personne ne va vouloir vous tuer.
Write to us. Our address is Healthy Living, VOA TV2 Africa, 330 Independence Avenue Southwest, Suite 1728, Washington, D.C. 20237, USA. Our email address is africatv@voanews.com. And our website address is www.voanews.com/TV2Africa.
Welcome back to Healthy Living on the Voice of America. I'm Lenore Moudou, and we are discussing autism. My guest is Sandra Cunningham, president of the Autism Society of America, District of Columbia chapter. Also joining us now after the break is Mrs. Bridget Covenant. She's the parent of an autistic child. Ladies, welcome to the program.
Thank you. Thank you.
Mrs. Covenant, let me start with you. Thank you for joining us, by the way, during the break. You have a son who is autistic. He's over 5 years old. Can you tell us about your son?
Yeah, my son is now just turned 7, and he's autistic. He has a spectrum. And I don't know if you want to go into when we discovered
Let's
all
talk
that
about
stuff.
when you first found out that he was autistic.
Okay, we first found out that he was autistic when he was about 4 years old. Actually, his pediatrician didn't find this out. He went on vacation in Canada to see his grandpa. That's when he ended up at his cousin's pediatrician. he realized something was wrong with my son.
The cousin's
pediatrician. Yeah, because my son wanted to tag along with his cousin because she was sick. So they went to see the pediatrician in Canada. So he just tagged along, and then the pediatrician noticed that my son had something that was not right. So he asked his grandpa, he said, whose son is this? And he said that, you know, it's my son, his parents are in America and all that. So the pediatrician said, he has something, he has a spectrum, and he wrote down everything, the diagnosis, the prognosis, everything right then and there. And my uncle actually faxed me the prognosis from Canada and told me that Diana, who is my son's cousin, pediatrician, say he has something called autism.
And that's how you found out? And
that's how I found out.
What did you do as soon as you found this out? Did you ring a bell into your mind that all along you thought something was wrong with your son, or were you completely shocked?
Well, we knew something was wrong, and we kept asking his pediatrician here in America, not to, you know, badmouth his pediatrician here in America, but this pediatrician kept telling me not to worry because we speak two languages, you know, French and English. So he kept telling me, boys are late bloomers, don't worry. You know,
a little bit like what you
said,
Mrs. Cunningham.
Exactly.
She was talking about that earlier.
Yeah, so we didn't worry, and we kept, you know, not worrying until we realized that there was something wrong. So when I got that from the pediatrician in Canada, I was devastated.
Of course. So what did you do as soon as your son returned from Canada? What was the first step that you took?
I called the pediatrician, first of all, to lash out on him and give him, you know, let him have a piece of me. And then there's a phone number in school where they say if you need help, call. And I called that number from the school, and they told me about what they call Child Find. It's a program where you go there and they test your kid to see exactly what's wrong, whether he has autism. You know, it's a spectrum, so to know where he is,
what level
and all that.
Yes.
Right. So that's where we were.
So what did they find out after the test?
Yeah, they confirmed what the doctor said.
What was his level, if I can use that term? Was it very critical or a beginning stage, or how do you determine?
They call it high functioning. His particular level is called PDD, pervasive development disorder. It's called PDD. So on the level, you have the Asperger syndrome here, which is the high level, high functioning, and you have he's about this side here, and then you have the extreme on the other side.
Okay.
So he's not extreme; he's towards the high functioning side.
Let me stop there with you and come to you, Mrs. Cunningham. At what level was your son when he was diagnosed?
I don't know whether they gave him a label. This was, but I think he's probably closer to the end, based on the fact that he does not have a spoken language to speak of, even though he has a good memory. There are a lot of things he can do for himself, but he does not have that. He doesn't have the ability to really communicate and, you know, like hold a job without having someone 24/7 supervising and helping him. Okay. You know, he can put on his own clothes, and there are chores that he can do around the house, and he knows when the end of the month comes, he changes the calendar, all the calendar.
So he can do
certain things, yeah, but I wouldn't call him...
and he's not fully independent or anything like that?
No.
Okay. Mrs. Cabena, let me come back to you. Unfortunately, we're running out of time, but tell us what you're doing now with regards to your son. He's 7-year-old. You found out he was autistic when he was 4, so 3 years of treatment, of follow-up. Yes. What happened? What has been happening?
Well, we moved to Arizona because through my research I realized that there was a lot of autism centers in the Southwest. So we moved there without thinking. We could have stayed here in the East Coast, but we went there. So through there we went through what we call the SOC program, which is the behavioral intervention program. That they literally gave them word to speak, because the thing with autistic kids, they need to have the word to use. So they did the speech therapy. It was one step at a time. We did that, and then we went through also the homeopathy. That's the path that we chose. We chose
homeopathy.
The homeopathic.
Because?
Yeah, because the homeopathic seems to work very well with Vinny because Vinny is his nickname. Because with the homeopathic, he helped him develop the senses that his body didn't develop because of the autism. For example, if he didn't know how to play to be in a group, big crowd, he was very shy. Through the homeopathic remedy and medicine, he actually learns step by step how to accept the crowd, and the sensory more and more, tuned to what he's doing.
And now you've seen a tremendous change from when he was diagnosed to now?
Oh yeah, a tremendous change. Like she said, her son doesn't have a word, my son didn't have any word at all, but now he can communicate, he can talk, he even make jokes.
Wonderful. Thank you so much for coming. Unfortunately, we're running out of time. We ran out of time to discuss autism, but we're definitely going to have a second part, and I hope to have you ladies back soon so we can continue this conversation. Thank you. Well, on today's show, we discussed autism. Did you learn anything at all? If you did, we want to hear from you. And guess what? You will win a Voice of America t-shirt. The first 3 viewers to write to us via mail and the first 3 to email us will receive a t-shirt. So get on your computer or grab your pen and paper and tell us what you learned about autism in today's program. Don't forget to include your name and address with your answer. Our email address is africatv@voanews.com, and our mailing address is Healthy Living, Voice of America, TV to Africa, 330 Independence Avenue, Southwest, Washington, D.C., 20237, USA. And that's Healthy Living for today. I'm Lenore Moudou. Join us again next week for another episode. For more information, always log on to our website, www.voanews.com/TV to Africa, and click on the link to Healthy Living. If you want any information on the ladies, on the organization, or what they're doing, please send us an email again at africatv@voanews.com. I'm Lenore Moudou, and until next time, take care of yourself.